Dr. Choll came here from sunny San Diego, California. I had a 40-year-old dad with 2 annular tears, and his daughter texted me over the weekend asking me to do a really good job because she wants her daddy back. Yikes! So I got to do a perfect job with these 2 annular tears, which is causing him this nagging low back pain that is not making him wheelchair bound, but he can't play with his daughter. He's probably a little cranky by the end of the day because that's how I would be. So fingers crossed, lots of pressure. I love it. All right, we're getting started. I made the perfect pole Choll entry point. And now I'm using the spaghetti noodle dilator to make my way down there. Shot. Feeling good. Okay, I've got the spaghetti noodle dilator right at the back of the disc. I inserted this skinny little needle into the middle of the disc. Now I'm injecting this blue dye, shot and save. I can already tell the L5S1 disc is kaka-poo-poo, shot and save. It should look like a hamburger. 2 buns with a patty in the middle. See how irregular it is? And you can probably already start to see it leak out the back there. Shot and save. You can see it outlining the annular tear now. Very cool. Shot and save. Shot and save. Like that. Okay, so here's the very first look at the back of the spine. That is the bony corner. The percutaneous entry point is right here, but it's a little too low. So I need to create a better position window, tiny one right here. So I did a shallow docking, direct look technique. Because yeah, we want to control everything. We want everything perfect. Otherwise the 6-year-old daughter is going to send me another text with a sad face and I'm going to crumble. This is the endoscopic drill. It's got a diamond cutter instead of a sharp cutter. It works slower, but it's way safer. And it also prevents the bony edge from bleeding too much. Check out how many things my left hand is doing all at once. It's crazy. My thumb is controlling the depth of the drill so it don't plunge inadvertently. I have the scope with my index and middle finger, and I have the cannula with my pinky finger. And then my right hand, it's just dumb. It just sits there and holds the instrument. Okay, here's the first look in the canal. You can see the blue dye. That's looking toward me. I'm upside down and backwards. That's where I went in. That looks good. Toward me, I'm going to flip the scope around so I'm looking right side up in a second. We'll be able to see the canal and the dural tube. And that is always exciting, if not scary. And if you're a thrill seeker, this would be really awesome. If you're a nervous Nelly, it's like a horror movie. You'll be scared to death. Okay, so I'm going to look medial. So now the 12 o'clock position is where the action is. It's where all the nerves are. It's the canal this way since I'm on the left side. I'm going to rotate the tongue of this cannula and use it like a pimple popping tool. So there is the dural tube across the top. You can see some veins on it. It's got a little layer of epidural tissues, which is mostly fat, and then this flimsy tissue like reticular tissue. Oh, but the key thing is that is totally safe. So you know, my mom always said spine surgery would be a lot easier without blood vessels and nerves, and when we first go in, the nerve is always at risk. So part of being a good spine surgeon is avoiding injuring the nerves. I know it seems obvious, but we have to remind ourselves sometimes to be extra careful. So now I'm just going to lean more and more toward the middle. And I'm going to look for the empty tent sign and a hint of blue dye where it's not supposed to be. It's okay to be blue where I went in with the cannula. It's not okay to be blue anywhere else because you should be really, really white and firm like a hockey puck. Okay, so I'm looking medial by leaning toward. I went in way back here, way back here, so that's supposed to be blue. But look what happened when I went more medial. Here's the little bit of the white annulus. It's supposed to be all white. But look at that blue thing right there. That is the annular tear, and it has the empty tent sign. It's like pathetic. It's like, what's in there? Nothing. Where's the beef? This is actually not as bad as some others, but I am feeling very good that I'm at the problems area. And now I have to just do some work here. Okay, now we got the laser. It fires sideways. That red laser is just the aiming laser. It's not the actual working laser, but how cool is it that I can just aim that exactly where I want to go before I even turn it on. Small drawback, it's not very good for blood vessels. The trigger flex probe, the radio frequency electrical probe, is really good for blood vessels. But I suspect somebody can figure out a laser wavelength that works well on blood vessels too. And then another one that works really well on bone. And another one that really works well on nucleus. And another one that really works well on annulus, because you can do that with a laser. Okay, so I've got this thing right underneath the annular tear on MRI, right in the middle. Having said that, I'm going to just reach over however far I need to, but look at all this kakapupu disc right here. It's going to come flying out in a second. Okay, here's the stuff. Yes! This should not be loose like this. This should be firmly attached in a bed of crisscrossing layered collagen fibers. It's essentially steel belted radial tire. Right there, look at that. Curlicue too, Terry. Using an angled grabber so I can reach up and across. I know, really sneaky of me, but you need so many specialized tools when you do this surgery. And I can feel loose pieces right there. This is 501 level, is the level that looked the worst on the MRI. There's the dural tube, it's totally intact. That's the first thing. And two, it's totally released from all its adhesions, because that's what happens with chronic inflammation. And then this is all the way to the midline, and I also went underneath. So I'm feeling really, 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 really good. Okay, 5-1 is done. It went perfectly. I know I use that word too much, but if it's perfect, it's perfect. You got to use it. Shot. Ooh, I like that long old time. Okay, 4-5. Shot and save. Chromatodiscogram time, shot and save. Another kakapupu disc, but we knew that. Okay, I'm at 4-5. I'm making the little entry point. Same thing under direct vision, being so friggin' careful. Using my delicate Asian fingers. Liking it. Long time, long time. Long time there. I feel like a dentist. Okay, so here's a couple of cool things. There's the nerve probably. Everything's a nerve until proven otherwise. No, that's probably the tear in the posterior longitudinal ligament and annulus, because it's blue, but you never know. That white thing right there going across, I thought was originally the dural tube, but I don't think so. I think the dural tube is behind that wall of fat. And I'm going to nudge it over using my cannula as a pimple popping tool. And that's what we'll make sure. Okay, I'm really glad we're at 4-5 because there's a little protuberance that you can't tell on MRI. And then there's the empty tent sign right there. It should be really hard like a hockey puck, but no. This is sad and pathetic because there's a bunch of blue stuff stuck in here. See that? I really like the blue dye. Can I have the laser now? Here's the laser. Oh, I love this thing. I'm sorry, dude. I have to admit though, I feel like a cheater whenever I use this. It's so awesome. Okay, let me have the paprika curette. You can really see the annular tear. It's white down there and then blue right at the back. Oh yes, look at that kakapupu right there. I found the kakapupu. It's way more in the middle. You'll see it in a second. It'll be really blue. There, look at that. Bye-bye. Away with you, kakapupu. Okay, all done at 4-5. We're almost all done. There's all the blue. It's gone, gone, gone. And right there is the nerve. That red thing. Look away. I mean, it's not the dural tube. It's got a layer of epidural reticular tissue, which has embedded within it the fat cells and a bunch of blood vessels. The dural tube looks almost gray or blue when it's completely bare. And I don't like devascularizing the nerves. It's part of the tenets of minimally invasive surgery. That's the disc. The blue part is gone now. Oh yes. Everybody, and look at that thing pulsate. That's your heart rate right there. 1, 2, 3, 4. Surgery's all done. I did it through these 2 little incisions. It's going to look like you have a vampire bite, but you know, instead of the vampire, their teeth going like this, they go like that because it's 2 vertical poke holes, which I cover with a Band-Aid, which I think that is actually the coolest part. Second only to our prayers, desires, and wishes that you get a great result and you have a very speedy recovery. Right, guys?